Our main goals when we go out on an emergency scene is to take care of the property, take care of the citizens, and also take care of our firefighters.
Goal 4 for us deals with expanding early intervention strategies.
We expect that we have no acceptable level of crime. 3 years in a row now, Irving has set lowest crime rate in our recorded history. Over the last 5 years, violent crime has gone down more than 31%. And we want to focus not just on crime, but also on helping people understand how they can be safer, how they can keep themselves safer, and their property safer.
Well, we have the crime-free multi-housing program, and then we also have the new mandatory crime reduction ordinance. We meet with those complexes that have the highest incidence of crime on a regular basis, and we hold numerous crime prevention and crime watch meetings on those properties.
The feedback we get from the residents is, I mean, they just couldn't be any happier right now. They feel like they've got their community back. If the crime's gotten out of control, we basically try and give the street back to the citizens. Tudor Lane is probably our biggest success so far. It's obviously geographically a larger area, a lot more people, and different problems, but we are seeing the same results we did on Tudor. It's just a little bit slower process. I can't describe, how happy I am to see our street return to how it was, and the residents being able to, enjoy it as they should.
We continually look at trends, make deployment or change our deployment strategies, and try to address things as they are emerging.
We're looking at it kind of in a three-pronged approach. We look at education, intervention, and enforcement. We've had a 100% success rate with the parents giving us the ability to look in the child's room, pull out any paraphernalia that might be gang-related, and further educate the parents. I think our success, you can see that based on just the lack of continued activity in different areas.
Irving Police Athletic League is a crime delinquent prevention program that's offered through the police department. We kind of have a safe haven for the kids who come out where they're being supervised by police officers. During the winter, we run anywhere between 60 to 70 kids on a regular basis. During the summers, anywhere between 90 to 100 kids on a regular basis. Some of them say that if it wasn't for the PAL, they would be getting involved in gangs just like their friends did.
The Summer Hoops program is basically a program that the police department came up with or started last year, geared towards 10 to 14-year-old boys and girls. The kids got a place to work out, they got a safe environment, and we also had, through an agreement with the Parks and Rec department, lunch provided. These kids are going to be the leaders of the future, and we want to help them be the best possible leaders. Our goal was to go after the summer months, so we did realize a 20% decrease from the year prior to our starting the program.
There's a 56% decrease in severity, and that's the overall severity, and then a 57% decrease in the right angle collisions.
What this tool allows them to do is actually drive down the street or parking lot, and it reads about 5,000 to 7,000 license plates per shift. ALPR could be an excellent tool for police officers to proactively prevent crime.
Not only does it give them the location, the actual location, the caller information, it also will open up a window and give them a visual map and plot the address on that map for them. It has improved some of the response times.
They go out across the community and talk to residents. So we'll take our equipment and we'll explain to them how it works and what we can do about fire safety and 911 and stop, drop, and roll and all the things that we talk to them about. If they don't have a working smoke detector, fill out an application And what we'll do is we'll send the firefighters in that district out to give them that smoke detector and assist them, especially the elderly residents that we have, and assist them in getting those in their home. That allows us, if we go into a household and the resident or patient is unable to speak with us or communicate with us effectively for whatever the reason, we can have someone check that. And if there is a vial of life indicator, we'll know what medications they take, what medical allergies they have. It's a great help for us.
It could be eliminating hazards. It could be passing on knowledge. It could be passing on safety. The main thing for fire appliance is life safety. So when it comes to life safety, that's goal number one.
Being able to upgrade a lot of the equipment and the supplies and the training, I think we have made a significant impact on the survival rates. Basically, LifePack 15 is the latest 12 EKG machine available. They will give us the capability equal to what you would get at a cardiologist clinic. We are in the process of changing 4 drugs and adding 2 new drugs to be able to better take care of the patient. Some of them are more effective or more rapid.
Blue Christmas is one that I think is probably the most well-known that we take part in. But we have, of course, our MDA, Muscular Dystrophy Association, Fill the Boot program. Saving lives, I mean, that's what it's all about.
It's just good for everything all around when you have a safer community.
When you call a fire truck or an ambulance, you want them there quickly, and that's our goal, is to make that happen.
But we really want to focus on, we really want to meet whatever need we can and just help to improve the quality of life.